Into the Fold is a podcast on mental health issues, produced by the Hog Foundation for Mental Health. I'm your host, Ike Evans.
I think it was important for the Hog Foundation to, not only because I think it needed to be called out, and you need to call out an issue when you want to address it, you have to identify it, but also it was important for us internally as a foundation that has said, diversity, equity, and inclusion are values of ours. And if that's the case, then we need to be transparent about it, because it puts us, so to speak, out there and available for others to question and to criticize. And we value that because it helps us to become a much better and stronger, I think, organization and stay true to our values. And so within that context, I think between internally what it did for us, but also to let our constituents, our stakeholders, and our colleagues out there know how important of an issue this was.
When I was living in New York City in the 80s and 90s and working very hard as a volunteer on HIV services and community health education, HIV prevention, I experienced a number of big losses at the time. Among them, my own partner died of AIDS. So I was in sore need of mental health services, and I was referred by my HMO to a particular person. And when I met with them, I said, I feel in Spanish. I need to convey those feelings in Spanish. And the gentleman before me, who was very white and very Anglo-looking, opened his mouth and spoke to me in perfect Spanish. So I was able to find the services I needed because I was very, very lucky. But of all the services available, I would have not been able to really find the support and the guidance that I needed at a time of grief and need. So I relate very personally to the importance of this parity between the providers and the population seeking health services. And the work that I've been doing over a long time is in fact in working with immigrants that are health professionals in the countries of origin. And when they come to the US, they end up driving Uber. My program works with them to try to return them to the health workforce in some capacity, and thus infuse this workforce with cultural language and different perspectives to enrich our health workforce.
When I think about health equity, I think about really ensuring, how do we ensure that where there are these systems that as Dr. Fernández-Peña said, it's not just by luck, but really that the systems themselves actually promote equity and opportunity for everyone. How do you create those kinds of systems? It translated into me pursuing, initially in my career, pursuing medicine as a desire to serve others, and seeing in my training where we were serving communities where getting to our clinic was difficult because of a lack of transportation or being food insecure, and trying to assist the patients and families that we were caring for. And just remembering the opportunities that I had as being the daughter of immigrants, to know that what we have to do is really ensure that it's not solely saying it's an individual's responsibility, but it's society's responsibility to ensure that the conditions are there that actually promote opportunity, equity, health, and well-being.